I think there's some more time.
No, we are ready. So thank you, Ajanta Pharma, and especially Dr. Tityal, because he called me up and said, please, and I'm very grateful to him. I'm just going to show some tricks. Some videos are very, very old, 20 years old, and I'll show some mistakes that I made so that we don't carry on the same. So the first video is, you can see here. So these are Gresha Bayer hooks. Some of you might not have seen them, but now we get fantastic hooks in India, which are 500 rupees. They're not all that expensive. These are old. Now, what is very important here is to, do we have a pointer here? Okay. So you can see a nice rectangle that we made here. And this gives you enough space to do your CCC, and there is absolutely no problem. You can go ahead. But very important that you make four marks, which makes a rectangle, and then put your hook. Sometimes you're in a hurry and we think you're very good and we make a mistake. So you can see this was a old scleral incision. You do your CCC that way, and that goes ahead. Now, if you do not make these marks, no, it's okay. It's okay. I know what. So if you don't make these marks, what is the mistake you can make? So I'll show you a next video. So this is a mistake you can make. So you can see that it is a rectangle, but this is not going to help you. So here you need a fifth hook to make sure. Otherwise, every time you do phaco, the iris will try to come inside. And once you hold the iris, it will keep coming inside. So take home message here is make sure you make those four marks with a pen and then make a side pot and then put in the hooks. Okay, so that's trick number one. So here you can see I still got away with it. Now coming to the Malukan ring. So I'm going to show you mistake that I made with the Malukan ring and then what I do so that it doesn't happen again. So the Malukan ring, fantastic device. Put it in the eye and then go ahead and then go ahead and then just put it so you can get one scroll in. It's very important to try to get the third and the second scroll together at the same time, but sometimes you miss it. So you have to actually tilt your hand a little to your right, a little to your left to get both the scrolls in at the same time. But you'll see here that I miss it. Okay, so you'll see that I'm missing it. And now one scroll has gone into the iris, the inferior. So now this you should never do. So what I'm doing is I'm using Sinsky hook to scroll this Malugan ring. So never use a Sinsky hook, never use a T. I'll tell you what is the best device for this because sometimes this slips. And if it slips, it goes behind the iris. So yes, here I've got away with it. Now I'm using the Sinsky hook again, and this go ahead and do your thing. Now this is another the same Malugan ring, but now you will see that in one shot, I'm getting the inferior one, and then I'm getting the left, that's the temporal, and the nasal in one shot. So what I'm actually doing is I'm tilting my hand a little bit to the right, a little bit to the left, and got it. So the right device to use here is a Krugner's hook. Okay, so this is what you're seeing now is a Krugner's hook. Go through the side port, which is a sub-incisional one. Go ahead, take the scroll and put that. You will never miss it. It won't slip behind, and you will be right on dot. So this is another trick. Now, as far as the removal of the Malugan ring is concerned, you don't need to disengage the inferior, the nasal, and the temporal. You just need to disengage one, which is the sub-incisional. Once you've done that, you can see that I'm just putting it into the plunger and then retract the plunger. And you can keep holding on there, the Krugner's hook, and make sure you just press so that these two just come into and just keep retracting. So it's only one thing that you need to retract. Now, the next step is this. I'm sitting superiorly, and there's an iridodialysis which actually gets covered. Now, in such a scenario, you're having a smaller pupil in that area. So, best is to put two hooks there. Once you put two hooks there, you can see just retract. Go ahead and do your phacoemulsification. Everything is fine and nothing to worry. Now, one more way when you have a small pupil is to create a diamond. Okay, so here you can see I'm creating a side port. Now, here again, I had made one mistake and I'll tell you the trick there. So, I made 4 points, okay, going ahead and then making one iris hook, getting the other iris hook. So, you get a cat eye and then the nasal and the temporal. So, here what I did was I made a main incision next to my iris hook. You can actually take the superior iris hook at the scleral level and take it more behind, and you can make your main incision anterior to the hook. So that's one more thing you can do. Here you can see that I'm just rotating it. Once you rotated it, you got a nice big diamond. Once you got a nice big diamond, everything is fine, nothing really much to worry. So you can see here, and then I'm making the main incision next to it, and you got enough space to do your CCC. You can do your phacoemulsification, and here I'm going next to it and then doing your CCC and going ahead. So this is fine. This now how to remove this hooks. Many times there's a huge question. There I'm going to show different tricks as to how to remove this hook. So I'm holding the main thing, retracting and pushing it in, and remove the plunger which is actually holding on to it. So here you can see I've just removed it, which was actually holding on to it. So here very important that you rotate this hook as to the main side port that you've done. Now this is the superior one next to the incision. Again, hold the hook and pull the plunger out, and you can push it back in. So this is one way. Now I'll just show you two, three techniques of removing the hook. So here I've gone in, rotate the hook horizontally. Once you got it horizontal, you are in the plane of your side port, and just it just comes out. So it's very simple. Same thing here. You can rotate it, make it horizontal, and bring it out. Now sometimes the opposite ones are a little tricky. So again, the same rule: hold the hook and pull out the plunger which is holding on to it. Okay, and then once you got that in, the next trick is you go through the main incision, hold the hook, and just bring it out. So you just hold the hook and come out through the main incision. So this is another very simple way of removing these hooks. You can see the lenses in the bag. Again, the same trick here. If you're finding it difficult to rotate, don't worry. Just push the hook back into the eye and then go in through the main incision, hold the hook and bring it out. So this is one more trick of removing these hooks. Now, this is the last part of my video. Some of you might not have ever seen this, and that is called something very, very different. I've done this in deferred live surgery. This is an unedited video, so you will see me struggle a little bit. Why is it unedited? Because it was a deferred live. So I'm just showing as to how it can be done. So you can see I've made a side port. Now this is called the omega ring. Some of you might not know anything about it. I know. Besides RC, put your hand down because Dr. Kankare and Dr. RC are the inventors for this. But for those who don't know anything about this, this is called an omega ring. This is the first time I'm opening it, and I've used this ring. I'm very happy. It comes in a container. Point one is it's autoclavable. You can even ETO it. And then I'll tell you some more details about it. And it's a brilliant design, I thought, because it's okay. It has its own problems, but again, at the same time, practically speaking, it's very, very practical to use. So you can see this is how the omega ring actually looks. You can see how it's going to hold the iris. So there are four notches which actually hold the iris. Now I'm taking it out. It's completely unedited. Okay. And then I put it on the eye. And now the Meligan ring can be injected. A BX ring can be placed inside. But here, so you can see I have a 2.2 millimeter incision. Was a little struggle to push it in. Now, this is a very shallow anterior chamber. It's a 1.91. So you think this is a very thick ring for a 1.91 anterior chamber? Not really. It works quite well. So I got two scrolls which are actually going to hold on to the iris. You can see a hook area there which is actually going to hold to the iris. So I'm pushing the whole ring into the anterior chamber. Again, it's topical anesthesia. You can see that the patient is moving. Now, this is a Krugner's hook. I'm holding on to this and just put it below the iris. And that edge, which is elevated, is actually going to hold the iris itself. So again, one gone in, the second gone in. And I want to show you during phacoemulsification, IOL implantation, bimanual IA, how does the ring really behave? Does it wobble? Does it unhook itself? Really, nothing happens. What is the material it is made of? How long will it last? Etc., which we can discuss. I still have 2 minutes to show. So you can see now we got a nice round, large area. Some people feel it should be round and it's better to do, but really no. Again, put in your viscoelastic, go ahead and do your CCC. Once you've done your CCC, you can do your phacoemulsification. So you can see during phacoemulsification, it's a fast forward. There is absolutely nothing happening in the anterior chamber. That's not my hand shaking, but it's the fast forward of phacoemulsification. So once this is done, um, just remove the nucleus. Now let's look at it. What happens during bimanual IA? The ring is still sitting beautifully. Just look at the four edges which is holding on to the iris. So you can see, just put in the bimanual IA. Once the bimanual IA goes in, do the bimanual IA and then go ahead and put your lens into the bag. Now the question is how to remove this ring. So you can see the lens is going into the bag. So again, it's very easy, but again, you have to make a little effort to get it out of your inner lip of the incision, which is necessary. The lens goes into the bag. Once the lens is in the bag, you again remove the iris, which is held on by the omega ring. As you can see, the lens is going very easily in the bag. You have to be a little careful when you're dialing the lens into the bag because sometimes the haptic itself can take the ring behind with you. So that's one care that you have to take. So this is in, the lens is in the bag. So now again, I'm using the Krugner's hook. Just unhook it from the iris and bring it out. So you can see that I've got it up. And then again, you have to hold it with a Macpherson's or a lens, whatever instrument you have. So you have to gently take it out of the inner lip. You can see that sometimes it engages in the inner lip and it may not be that easy to come out. But you have to put a little bit. This was, as I said, a very shallow anterior chamber. May not be a right case selection for case number one, but this is completely unedited because I wanted to show that sometimes this can happen. So it's step number one, and then I'm holding on to this. Again, keep on injecting viscoelastic up and below and just hold it and then make sure you got your inner lip in, and once that comes out, the rest just follows. So I did not unhook the other edges of the omega ring. So here you can see that I've just brought that out and then same way continue to bring it out, and that does everything, and that's it. So just for your information, thank you very much. So the omega ring is made of silicon sleeve material. Okay, so that's the best part of it. Two, it is autoclavable, the case itself and the ring itself. Three, it costs 3,000 rupees. I have no financial interest. So I think it's really reusable, and that's the beauty of it. Thank you for your attention.
Thanks, Kumar. Kumar, a quick question. Which one do you prefer? When do you prefer a pupillary?
Sorry, Kumar, you had to answer
Kumar,
the question.
which,
What do you prefer?
So
a pupillary hook and or a retractor, a
ring.
Malgane
I
or
prefer
whichever?
a ring any day.
Sorry.
A ring, not a
A
hook.
ring. Okay, a ring. So how many of us are using nylon hooks?
Correct.
Everybody. How many of us are using Malugan ring? Others are not using anything who are not raising. Okay, how many of us are using BX? Oh, okay. So, and omega.
Both had Darcy.
So BHEX is clearly now the device for expanding the pupil. It looks like. Sir,